Hello, and good evening once again. Dr. J here at Ask the Gynecologist, and tonight is going to be an open session. I'm going to take questions and I'm going to try to answer as much as I can. I know since it's an open session, people want to ask questions as soon as they can, but we still need to be organized so that I can answer as much as I can within the 30 minutes I have today. So once again, I want to say good evening to you all. My name is Dr. J at Ask the Gynecologist. And for those just joining ATG for the first time, let me introduce myself and introduce what ATG is all about. ATG is an online group on Facebook, most essentially started by me November 2015 by the grace of God. We grew from 50 people to about 1,000 within the first two weeks of the group commencing. And by the grace of God, we've been able to grow and sustain our growth from then till now. If you know what it takes to build a company from scratch, you understand me. During ATG's inception, over the last 12 months, essentially, we've doubled our hustle by the grace of God. We've basically opened a new laboratory in Lagos, Limosho, and we're opening a new one soon in Surulere. Same time as well, within these last 12 months, we've been able to produce and start our own IVF clinic center in Alimosho. IVF is expensive. We're trying to bring it down. But things are very, very prohibitive in Nigeria, but still, yeah, we're still trying to push things. ATG itself is not funded by any organization outside. It is our own growth by you, through you. So ATG has been going through struggles, through teething pain, but we overcome every challenge that comes our way. And let me tell you something, we're not yet ready to stop. We'll keep going, we keep pushing barriers until God says it's time. But we'll keep doing our best because our purpose here in ATG is to ensure that we give every woman a voice. Sometimes we come up every day to talk about women problem every day, but we try as much as possible to ensure that we are keeping the conversation going. The need is that women need to be able to talk out, express themselves, try to get pregnant, celebrate their children, talk about gynecological problems, and we have seen this need and we have plugged this gap and we continue to do so. During ATG's formation, many people have come, they've left, many doctors, many people, but still yet, God's purpose for ATG still stands and will still continue to work strong by the grace of God. That I have no doubt, and I've resolved that, and it's going to be by the grace of God. The solution we are all doing here in ATG is ensure that every woman that comes across us that desires that pregnancy, that change, that addition to their home, they will get pregnant. And we'll try as much as possible. As far as you are here, please try and follow our instructions to ensure that your story is not the same. Your story is changed positively. If you're watching me on Instagram, I want to say good evening to you all. Thank you, Lex Queen. Thank you, Adeyemo Adebukola, my wonderful cousin. Thank you, Beauty Chinenye, Akin Dutire, Esther Deshina, Kenny, Aka, Faith Ivinduru, Patience, Beauty Chinenye, Nasinachi, Lisa Kamsi, Cynthia Oluchi Felix, Vivian Dico Briggs, Happiness Okeke, Fancy Celestia Joy, we have Ijoma Geraldine, Emmanuel Uchenna, Chinyeve AJK Okafo, Faith Vin, and we have many people already watching. Stephanie Asan, Francis Celestina Joy, Happiness Okeke, He, Chimax Shekarau, and everybody here. Basira Talimi Adejumo, and so on and so forth. Thank you, everyone. So I'll start taking questions now. Please let me answer one by one, because if you ask too many questions at the same time, probably I will not see them because I'm just human and I want to try and answer as much as I can. So listen, okay? Now, if you're here watching me, some of you may want to discuss with me one-on-one, you can use the ATG Premium Services. And as I say all the time, if you go to ATG Laboratory and get any test done at ATG Laboratory, you will have the opportunity for me to review your results personally. So once you go to our laboratory, you do all your tests there, Nike or Yemi, they will give you my WhatsApp number for you to forward all the results from our lab to me on my WhatsApp number, and I will chat with you and consult with you directly. By coming to do your test at our laboratory, you're automatically an ATG Premium Services member, okay? Now, Fauzia Diamond, you can hear me loud and clear. Omo Wonu on La Jaya Dekola. Buchi Silva is saying, Doctor, Chai, what causes sharp pain in the abdomen in a pregnant woman at 7 months? It's likely that you have what we call ligament stretch pain, okay, that you can take paracetamol for, or you might have an ovarian cyst. So get a scan done to check that there's no cyst in your ovary or anywhere, and also take some painkillers and limit your up and down. Okay. Your question is, what drug is best for low sperm count? If you have low sperm count, the husband should stop smoking, no alcohol, regular exercise, at least minimum of 30 minutes every day to sweat. Then you can take Adizua or Fertilovit M. You can get them on Jumia or Amazon, or go to our laboratory. We have plenty supplies of Fertilovit and Adizua. You can pick it up there, okay? But you should use it for at least 8 weeks and repeat your sperm count. Okay, that's important. Some people, it's not those things they need though. Some people, they have no sperm count at all, none. If that's the case, we need to do other tests to know why you're having no sperm count. But if it's low sperm count, it's most essentially your behavioral changes and using those vitamins. What drug can be taken to avoid jaundice in a baby? I don't know. To avoid jaundice in a baby, ensure that babies are looked after when they are born. If a baby has an infection while they are being born or after delivery, they can develop jaundice. Some people, it's not even infection, it's just blood group issues make them have jaundice when they're delivered. But no particular drug is designed to prevent jaundice in a baby. If your baby is prone to infection, we treat the infection, prevent the infection, and then they don't have jaundice when they are born. We have questions on Instagram here as well. We have Mimi, Nyerendia, Sophia, Keriako, Floral Perfumery, Swizis, Sidefa. I don't know. See, all the names on Instagram are like nicknames. They are difficult to pronounce. I don't know why. But anyway, we are here. What causes fatigue, stomach pain in a month pregnant? When you're pregnant, your body is changing, and your body is changing forever. When you're pregnant, a new baby is growing in your body. That new baby is consuming energy. It's like a nuclear factory, a nuclear reaction. That baby is changing every day. Imagine a baby that was born today. That baby already has bones in the brain, bones in the head, bones in the arms. When do you think that those bones were being formed? Those bones were being formed while the baby was inside. That means that a sperm came, egg came, they formed together, and they automatically changed and differentiated into all those tissues in that baby. That baby has eyes, mouth, nose, ear, lungs, heart within 9 months. What do you think happened? That baby was developing and changing every day, night and day, whether you are awake or asleep. That is to say, that baby is consuming energy. So your body is not going to be the same. Your body is going through a lot as a woman. That's why you need to be well fed, peace of mind, less stress during pregnancy, and eat well. Okay? And you're going to have some pain, some stretching pains. It's normal. And then Omalawa Afalabi Akinla De Sovio Abogo Itochuku, my wonderful, wonderful, beautiful sister. How are you? From all the way from Lagos. God bless you there. Lex Queen is on Instagram, one of our moderators, and I'm also here. Thank you, Vivienne. So if you want to watch, talk to me one-on-one, you can go to the premium services. Now, what can be taken to stop spotting in early pregnancy, 6 weeks pregnancy? If you're having spotting in pregnancy, it's a sign of threatened miscarriage. Okay? It's a sign of threatened miscarriage. So for such things, you should get ultrasound scan done. Get ultrasound scan done in early pregnancy. Any bleeding in early pregnancy is a sign of miscarriage. A lady that is telling somebody to go and give her husband or plantain for low sperm count, that is nonsense. So don't let anybody cajole you to go and say, go and drink agbo, drink or plantain, this and that to boost sperm count. If sperm count is low, first of all, find the reason why it is low. And in most cases, stop behavioral change, vitamins, no smoking, no alcohol will boost it, and perfect, well-balanced diet will boost it. If it's not happening, it's not changing, after 8 weeks of doing that, then you need to know why it's still low by doing scrotal scan, hormonal profile for the man. Can one conceive if a period is just 2 days? It's possible. Yes, you can conceive if your period is just 2 days. It's possible. What can a woman... Good evening, Okonkwo Grace. How can a lady that is not pregnant stop milk water? If you have milk coming from your breast and you're not pregnant, or you're not having a baby or feeding the baby, that means that your prolactin level is likely to be high. And if your prolactin level is high, that will make you not to ovulate. I preach this all the time on ATG. If your prolactin level is high, you're not going to ovulate regularly. And by that, you're not going to get pregnant. That is why if you have high prolactin, get it treated as soon as possible. Good evening. What medication can be taken now to get pregnant? You don't need any special medication to take to get pregnant. Once you're a lady, you're born a lady, designed to be a woman by God, you are designed to get pregnant if you want to get pregnant whenever you want to get pregnant. So if anybody is saying that as a lady, take a medication to get pregnant, they want to confuse you because you want to get confused. Now, vitamins, prenatal vitamins, pregnant care, they're not designed to get you pregnant. Okay? They're not fertility medications. No. They are medications designed to ensure that if you get pregnant, that baby does not have spinal cord or brain problems. That's all. Pre-pregnant care is not to get you pregnant. It's to ensure that once you get pregnant, that baby does not develop spinal cord problems or brain developmental problems. That's all. Like spinal bifida, holes in their spinal cord or in their brain. That's all. Nothing else. Clomid is to make you to ovulate if you're not ovulating, with appropriate checks and somebody watching you and looking after you, ensuring that you don't develop complications to it. If you've done Clomid for 3 or 4 cycles, it's not working, you have to consider IVF. Once you start using Clomid for 3 or 4 cycles, it's not working, next thing is to consider IVF. There's no joke about it. Okay? Even if you have ovarian cyst, you can get pregnant. I've seen many people, and I have colleagues that are pregnant now, and they had ovarian cyst. Ovarian cyst does not stop you from getting pregnant. Now, if you have endometriotic cyst, that is endometriosis in your ovary, endometriosis in your ovary, that can affect your ovary, that can block your tubes. But a simple ovarian cyst does not stop you from getting pregnant. If you have low progesterone, there are drugs we use to treat that, okay? The dufostin and stuff like that to treat low progesterone, okay? Can a woman conceive after 2 days of period? Yes, Mary Queen, Nena. If you have 2-day period, you can conceive on it, oh. You can. Yes, you can. Thank you. I can see people on Instagram here. Let me see if you have questions on Instagram. Hey, now, Sunshine is asking, how can you treat ovarian cysts? Most cases, if you have ovarian cysts and they are less than 4 or 5 centimeters, we leave them alone. Especially if they are simple cysts. They will go away on their own. Now, what you need to do is that you need to get scanned 4 months down the line or 3 months down the line. And if the cyst is still getting bigger or it hasn't disappeared, then we have to decide whether we take it out surgically. There's no medication that is designed to shrink or to melt ovaries or ovarian cyst. If anybody is telling you you can't take any medication, that this medication, no, it will shrink, it will melt your ovarian cyst, welcome to the world of lies. What can one use to boost ovulation? If you're not ovulating, we need to know why you're not ovulating. Once we know why you're not ovulating, then we can know what to do to boost it. Because if you're not ovulating because of high prolactin, FSH problems, we focus on that. Okay? We need to know why you're not ovulating by doing your hormonal profile first. Then we treat anything we can see there. That's the first thing to do. Ammonia Green, welcome, Adenyinka. Simple cyst, if it's 3 or 4 centimeters, leave it alone. If it's causing you pain, take it out by surgery. If you scan yourself in 3-4 months' time, it's still there. Is it getting bigger? Take it out. If it's getting smaller, leave it alone. Sometimes it will disappear on its own. But in most cases, most simple cysts, they rupture on their own and they get absorbed by the body and they go away. Okay? What causes blighted ovum? Sometimes infections, sometimes implantation failure, sometimes genetic problems. Sometimes we don't know. Sometimes the pregnancy doesn't just implant. Okay? All right. China Bernadette, thank you all the way from Australia. Welcome once again here. Sophie Smiles, welcome. Katini K1. Something Lady Pure, welcome once again. Floral Perfumery, thank you so much. I salute you there too. What causes cervix to be open at that question is gone. Guys, slow down. Let me catch this one, please. Okay, what causes cervix to be open at 5 months? If your cervix is open at 5 months, then you probably need what we call a rescue or emergency sacrilege to close it back. Sometimes it's open because your cervix is weak. We don't know. Sometimes we don't know. Sometimes an infection. But in most cases, we don't know. Some people are just prone to have weak cervix. Some people, they've had previous abortion before. I'm just saying it's possible. Some people, they've had previous abortion before and they've caused damage to their cervix and it's open and it's weak. We only have a laboratory in Lagos. ATG only has laboratory in Lagos. If you want to do your test of infertility, you can go to any reputable lab close to you, okay? And you can forward the results to me through our premium services, okay? But ATG Laboratory, ATG IVF Center is only in Lagos for now, okay? Good evening, doctor. Thank you for your good works. What can you recommend for someone whom HSG says that tubes are not applying? So if you got, Christina, you've done HSG and they say that your tubes cannot be seen. Basically, it was not outlined, means that it was not seen. That means that your tubes are likely to be blocked. And let me tell you the truth. If your tubes are blocked on HSG, the best way to move on, the truth is that you have to think of IVF. I know people don't want to hear that in Nigeria. They say it's too expensive. No, there must be a way to unblock the tube. No, so you can't do anything. Let me tell you the truth. Okay, the reason is that to unblock the tubes, okay, is done through hydrotubation. It's very painful, and in most cases, it doesn't work. Once tubes are compromised, once tubes are damaged, honestly speaking, the best thing to consider IVF. Because if you get pregnant naturally, even with a damaged tube, you're likely going to have ectopic pregnancy, which can be life-threatening. That is why in developed world, I know you say because we're Western world, not true. The human body is the same anywhere in the world. The human body has no different edition, just different color. Inside is the same. If I open a woman up, I'll find her tubes and her ovary and her womb the same way I'll find it in an Asian, Nigerian, African, Colombian, Brazilian. The womb is not found in the mouth. It's always found in the pelvis. There's no way I'll find your womb in your bum. It's always in your pelvis. There's no way I'll find your womb in your leg. It's always in the pelvis. So human beings are the same. So what will cause damage to the tube here will cause damage to the tube in Nigeria too. That is why if tubes are blocked, the best way out is IVF. Trust me. What causes ectopic pregnancy is IVF. So it's a woman here asking a question, a very important question here, that what causes ectopic pregnancy in IVF? Most people will assume that IVF will just put the egg in the womb, okay? But IVF itself also increases the risk of ectopic pregnancy. People say, why not? But the pregnancy was just put in the womb now. How will you now go to ectopic? Number one is that sometimes when you go for IVF, most of the reasons is because you're not ovulating or the tubes are blocked. And in such case, you might get pregnant even while the IVF was being performed. So you have what we call heterotopic pregnancy. You might have pregnancy in the tube, pregnancy in the womb. Some cases too, we put the egg in the womb, okay, fertilized egg. But for some reason we don't understand, they migrate and go and block the tube. Okay? Yes. So IVF itself has been known to increase the risk of ectopic pregnancy. What could cause fetal growth not to be seen on 7-week scan? That means that probably the pregnancy is not developing and it's a miscarriage. But it's too early to judge. So I tell people to repeat the scan again 2 weeks from then, 2 weeks from the last scan. And if the pregnancy hasn't grown after the repeat scan, there's probably a miscarriage. Doctor, is it possible for someone to miss a period and test negative? It's possible. Can one get pregnant with ovarian cyst? Yes. You can get pregnant with ovarian cyst. When can one do hormonal test? There are many hormonal tests. There are some we do between day 2 and 5. The LH, FSH. You can do your prolactin, testosterone, AMH at any point. You do your progesterone on day 21. Just call our laboratory tomorrow. And Nikia or Yemi, one of the doctors, Chuma, will tell you when and when to do your hormonal profile. And they will give you guidance. Just call our office tomorrow, okay? And the office address is already on the screen here. Okay? Pineapple is safe at any time. You can eat pineapple today before you're pregnant. You can eat pineapple in your first trimester. You can eat pineapple in second trimester, in third trimester, even while breastfeeding. My wife breastfeeds and she eats pineapple. Okay? So pineapple is no harm. Not only pineapple, any fruit that is ripe and in season is safe. All those trash, I say, you can't eat mango, you can't eat coconut, you can't eat walnut. It's all trash and baladash. There's no unsafe fruit. Every fruit, not food, every food is safe. So as it's eating balanced diet and is ripe, case closed. Yes, can one get pregnant with endometriosis? You can get pregnant with endometriosis. But if the endometriosis has damaged your tubes, you will not be able to get pregnant. Is it okay to have brand discharge in early pregnancy? It's not okay. Okay? Sometimes you have brand discharge in early pregnancy. It could be a sign of implantation bleeding. But those ones are very, very light, very, very tiny, and they don't happen. They don't repeat themselves. If you're having repeated bleeding, it's not normal. It's a sign of miscarriage. The number to call, Liz Queen, can you help me put the number of the office, of our ATG office, on this our Instagram screen? Liz Queen, can you help us put the number of the ATG IVF Center on this screen on Instagram, please? I beg you. Thank you, Abimbola Oluwaseun Babaralayemi, my wonderful sister. This lady, we grew up together. We went to the same school. We're also always in the same school bus every day. Thank you, Abimbola. God bless you. God bless you and your family. Love you so much, and love to your husband as well. Thank you. I'm so happy to see you here. Seeing you here is a real boost, and it's a real boost to me. Thank you, Abimbola. God bless you, and God bless my brothers as well. I'm happy to see you. Doctor, can I drink Zobo? Zobo. First of all, Zobo, I don't know. Some Zobo are prepared at home and they are prepared safe. If you did your Zobo yourself and it's prepared safe, it's okay. But I don't know what is in that Zobo you're buying outside. So I can't tell you to go and drink Zobo. I can't give that blanket advice, go and drink Zobo, when I don't know what is in that Zobo outside. If you have genital warts, it can be treated by liquid nitrogen, by freezing, okay, by cutting it off and suturing that base, or by giving some medications like imiquimod, podophyllene, which cannot be used in pregnancy. So there are many ways to treat. But if we see genital warts, we must also check for any other infection too. Does ovarian surgery affect getting pregnant? No. But if they've taken out all your ovary, you're not going to get pregnant too. So if they've removed your ovary, they've done oophorectomy, left and right, bilaterally. They've removed the ovary left and right. You can't get pregnant naturally. There are two different things. But if they've taken out a cyst on your ovary and they've preserved, left over your normal ovarian tissue, you can't get pregnant if you want. You did a hormonal test in my something. I saw a question here about hormonal test somewhere in the laboratory just now, and I missed that question. Chai. Okay, let's continue. Is it possible to get pregnant after ectopic pregnancy surgery? Yes, as far as the other tube that was left behind was good. During ectopic pregnancy, we take away the damaged tube, but we leave a tube that is okay. If that leftover tube is okay, you can get pregnant. What causes yellow discharge in pregnancy? If you have yellow discharge in pregnancy from vagina, is likely to be Candida. Likely. I didn't say it is. I say it's likely to be Candida. So get swabs done to know what is causing your yellow discharge. There's nothing called dry ovulation. I don't know. I've never... The things I hear from our people back home, I'm surprised though. Which one is dry ovulation again? I've never heard this before. Dry ovulation. It's like you're ovulating or not. And I say this all the time. You don't have to see egg white. And I don't know who brought this egg white business to ATG. I don't know where it came from. Egg white. In fact, I've never even heard egg white being mentioned here in our clinics, in gynecological clinics here. So I don't know who is bringing all this concoction about egg white. Okay? There's nothing about egg white can be seen or might not be seen. And it's not a criteria or a standard to say if you're ovulating or not. You don't have to see egg white to know you're ovulating. If you're not ovulating, if you're having regular period, you're probably ovulating. If you're not having a regular period, you're probably not ovulating. You want to know whether you're ovulating? Use your Clear Blue or go and do day 21 progesterone and let us know what's going on. Brand discharge in pregnancy is not safe. Go and get a scan. Aloha, Kate, our number for IVF office is already on the screen. Scroll, you see the number. Thank you, Sunshine. That's it. Adokwemu. You did hormonal test in a laboratory and everything was done on day 2. No, we don't do all tests on day 2. There's some tests we do on day 21. Go back to that laboratory and get clarity. Probably they didn't tell you everything. Probably you missed it. I'm sure they won't tell you that. Your baby is 1 year old. You want to try having baby again, you can start now. You can. It's up to you. Once you think you're mentally ready, you're financially ready, you can start. Mata Solomon, go back to the laboratory, okay? Mata Solomon, go back to the laboratory and get sorted. Can someone with big myoma get pregnant? If you have fibroid, myoma is fibroid, you can get pregnant. It's very rare for myoma or fibroid to stop you from getting pregnant. If you have fibroid in the womb cavity, it can stop you from getting pregnant. If it's blocking the tubes, yes. But in most cases, most myoma, most fibroids will not stop pregnancy. Hello, Han, Kate. Can some Gloria, can you let me give hello, Han, Kate, our office number, please, and our address? More fashion outlet. You can take the folic acid 5 milligrams. It's okay. It's okay. What is the chance of getting of someone with submucous fibroid? If you have submucous fibroid, just remove it. Submucous fibroid, you're trying to get pregnant, it's difficult, remove it. What causes low abdominal pain? Appendix, infection, ovarian cyst, previous operation, previous C-section, gallbladder problem, infection, urine infection. They can all cause low abdominal pain. Okay? Many things can cause low abdominal pain. Many things can cause low abdominal pain. So get a scan done. Check your urine sample. Do a test of pregnancy. Ultrasound scan of kidney. Check your liver. Check your appendix. Okay? And know what's causing your pain. You're 28 weeks pregnant. You have miscarriage and you got evacuated at 4 weeks. If you had a miscarriage, you had evacuation 1 month ago, you want to start having pregnancy, you can start trying as soon as you feel well, you feel comfortable, mentally ready, and you feel physically healed. Okay? Somebody will do the same thing. They will need 10 weeks. Somebody want to get pregnant immediately. So it's up to you. Up to you. But give yourself at least 6 weeks, okay? Can you get implantation without blood? Yes. You don't have to see implantation to know you have implantation. You don't have to see bleeding to know you had implantation. You don't have to see bleeding to know you had implantation. You don't have to see bleeding to know that you had implantation. What can one do to get rid of endometriosis addition in order to get pregnant? If you have endometriosis addition in your tummy, you need surgery to take it out. If you have additions from endometriosis, they must be taken out through surgery. Okay? Is there any chance of a matured egg or 24 millimeter not dropping for ovulation to occur? It's possible if you have polycystic ovarian syndrome. For 28 weeks pregnant, you were given folic acid and calcium, no other vitamins, that's okay. Once you have folic acid in your medication, you have folic acid, it's okay. And then eat balanced diet. Can a scan report starting collapse sac, something like that? Oh, I'm losing track. Guys, slow down. Questions. Too many questions here. I can't read them anymore. Too many. So you have to slow down. Let's focus on Instagram. Guys, slow down so I can answer questions, okay? There are too many questions. I can't see them. I can't even read them anymore. So slow down. Slow down. Too many questions. I can't even read them. Neither can I even answer them. So just slow down. Slow down. Slow down. Slow down. Okay. Let's ask a question here on Instagram. Can a single lady use folic acid? It's okay. But use folic acid if you're trying to get pregnant. If you're trying to get pregnant, you might not need folic acid. But if you want to take it, it's okay, safe. But, it's up to you. Are you trying to get pregnant? Yes, then take it. Doctor, is uterine artery embolization safe for a woman trying to get pregnant? If you're trying to get pregnant, you cannot have uterine artery embolization. If you're trying to get pregnant, you can't do uterine artery embolization. You can't. Once you want to do uterine artery embolization, you've made up your mind that you're not getting pregnant again. Okay? What can one do to improve getting pregnant? Okay. If you have ovulation confirmed, okay, you need to have regular sex and use pre-seed lubricant every other day. Okay? Don't wait for ovulation to have sex. Okay? By having sex every other day, using pre-seed lubricant, you can get pregnant almost 99% of the time. As far as all your tests are okay. husband is okay, his sperm is good, your tubes are not blocked, you're ovulating, you're having regular sex with Pre-Seed, pregnancy is sure. Can placenta previa reoccur? It can. It can be prevented. Okay? Placenta previa can reoccur if you had it before. In fact, if you have placenta previa before, you're likely to get it again. Facebook must slow down. On Facebook, I can't read questions anymore because they're too fast. Neither can I even understand or answer them. So you have to, everybody on Facebook, slow down. I'm focusing on Instagram now because you are too fast. Guys must slow down. If you can slow down, I'm gonna answer on Instagram, okay? So slow down. Doctor, what can I... Folic acid does not change your period. What do I do to ensure my ovary is perfectly fine? If you want to know if your ovaries are okay, do all your hormonal profile tests, do your ultrasound scan as well to check your ovaries. How long can someone wait after fibroid surgery before you get pregnant? Give yourself up to 6 months to 8 months before getting pregnant after fibroid surgery. Zif Miracle, thank you. Let's come back here again to Facebook here again. I think people are already maintaining civility and decorum here. Slow down, guys. Slow down. Let's take questions here on Facebook. So slow down. Is it advisable to go for cervical sacrilege in next pregnancy if you're having open? Yeah, if you had a previous cervical sacrilege because the cervix was weak, in most cases, if you get pregnant again, we need to do sacrilege again. We call that prophylactic sacrilege. Sacrilege basically done to prevent miscarriage again. Nikki of WOA, welcome. Does Pre-Seed work without cervical mucus present? Like I said again, Pre-Seed does not need your mucus. Pre-Seed does not need your cervical mucus. Okay? Forget about all those mucus thing. Forget it. Lubricant, Jide Luchi, Kalume, Eziaku. Pre-Seed lubricant. Pre-Seed lubricant. Can someone get pregnant with PCOS? Yes. Worry Esther about exclusive breastfeeding. If you can do exclusive breastfeeding, is the best. If you can't do it, then supplement. Don't kill yourself though. Does driving every day affect getting pregnant? No. Driving every day does not affect you from getting pregnant. But driving every day, if you're having stress, it can affect you from getting pregnant. Okay? Doctor, you've done a hormonal profile, HSG. Everything is okay. You're not getting pregnant. Is your husband's sperm count good? Are you having regular sex every other day? If not, then start doing that. As your husband, check the sperm count. If not, go and check it. Are you having regular sex? If not, start having regular sex and use Pre-Seed lubricant at every time you have sex, at every round. You're using pregnant care, calcium at 16 weeks, that's fine. You're using pregnant care at 16 weeks, that's fine. That's fine. How long can a woman wait to see a doctor after a period has been delayed for about 20 days? 20 days. First of all, Bokini or Malara, do a test of pregnancy. Now, today. Okay? And if it's negative, that means you're not pregnant. If it's positive, it means you're pregnant, start antenatal care. Okay? So, Malara, Bokini, do test of pregnancy tonight. Doctor, good evening. Is it normal when you see your period, use from 5 to 3 days? It can happen once in a while. Okay? But if it's persistent, then get your hormonal profile checked. But if it's just one-off, it just happened this month, it might not happen next month now, so don't panic. Victoria, pregnancy scan starting a collapse like gestational sac. Can this? Okay. If you have a gestational sac collapsed at your early pregnancy scan, I'll suggest don't panic. First of all, as far as there's no bleeding, as far as there's no pain, repeat the scan again 10 days from now. And in most cases, the pregnancy will be fine. But if you don't scan again 10 days from now and it's still collapsed sac, that means that pregnancy is miscarried. It's called what we call missed miscarriage. In missed miscarriage or missed abortion, there's no pain, there's no bleeding, just that the pregnancy is not growing. Can diabetes cause miscarriage? If you have uncontrolled, untreated diabetes, it can cause miscarriage. Uncontrolled, untreated diabetes can cause miscarriage. Again, uncontrolled and untreated diabetes can cause miscarriage. What's the remedy for a woman whose breast is bringing out water? Okay, if your breast is bringing out water, first of all, you see, this is not Babalawo business. Go and do prolactin test. Check your prolactin hormone. And if it's abnormal, we fix it. We treat it. Once you treat the prolactin hormone, your milk will stop. But if you are seeing breast milk in your breast, don't forget to do test of pregnancy as well, because you might be pregnant. Is it possible to get pregnant after 3 weeks of miscarriage? Yes, it's possible. What does it mean to have chronic bump while being pregnant? I don't know what you mean by chronic bump. There's something called chronic bump. Some things some doctors say, I'm surprised, because some doctors are, oh God, I don't understand. There's nothing called chronic bump. Forget about it. Okay? After ovarian cyst surgery, when can you start getting pregnant? If you have an ovarian cyst surgery, you can start trying to get pregnant after at least, say, give yourself at least 6 weeks or more. But I'll suggest 2 months, okay? Okay, well, that depends on what surgery was done. If it's a keyhole surgery, 2 months is okay. But if it's an open operation where we open you up, give yourself 6 months, please. 21-day cycle, does it cause infertility? No. What could be the cause of a pregnant woman having 2 sacs in her womb, but there's only 1 baby? Maybe that other one miscarried. That's all. And it can happen to any pregnancy, God forbid. Can I have cramps few days after ovulation? Yes, you can. Take paracetamol, ibuprofen for that. What causes delay in getting pregnant? What tests are required to do? So you just call the laboratory tomorrow, our lab tomorrow morning, okay? Speak to Dr. Chioma or Nike, the lab manager, and to tell you all the tests that you need to do. But you need to do, for example, your FSH, LH, prolactin hormone, testosterone, AMH, D21 progesterone, okay? Ultrasound scan to check your ovaries, okay? HSG, sperm count. Get it done at our laboratory tomorrow. Call the lab tomorrow and get it done there. You had a multiple fibroid, 30-week size, midline incision. MRI says you have various fibroids. Yeah. So if has it been removed? Yes, good. You want to get pregnant? Wait for your body to heal at least 6 months before trying to get pregnant. Nikki Israel, you had myomectomy 2 years ago. Can you have vaginal delivery? Yeah. If you've had only one operation in your womb, whether it's CS or fibroid, if it's one operation, you can try vaginal delivery. However, if that operation was done on your womb as an up and down cut, it has to be C-section. If you had one CS, you can try vaginal delivery. But if you had one fiber surgery, one CS, then CS. If you've had any cut on your womb, whether fiber or CS, that cut is 1. You had another CS or another fiber operation, it becomes 2 cuts. Every time you cut your womb open, it's classed as one cut, whether fiber or CS, okay? I hope that helps. What causes spotting after taking contraceptive? It's common. It's just, contraceptive can cause irregular spotting. It's known. Contraceptives can cause irregular spotting. That's one of their side effects. It's known. They do that. So it's not a big deal, okay? Don't panic at all. It's normal. It's the way they work. Good evening, Sheena Johnson Adokie. Can one do cervical sacrilege while pregnant with twins? Cervical sacrilege is done only if your cervix is weak. Because you have twins doesn't mean you need cervical sacrilege. Because you have twins does not automatically mean you need cervical sacrilege. Sacrilege is only done for weak cervix. Because doing a sacrilege itself can cause miscarriage. So we only do it if it's essentially necessary to prevent that miscarriage. Doing sacrilege itself can cause infection. Doing sacrilege itself can rupture the membrane or the bag of water. Doing sacrilege itself can cause miscarriage. So we only do sacrilege if it's essentially essential. Compulsory. Don't go and put your nyash into sacrilege because it's sacrilege. We only do sacrilege if it's only essential to prevent miscarriage. Because sacrilege itself can cause miscarriage. Okay? Amatula Wears, welcome once again. The Prince Hen, Inyek Moxie, Thrift Deals, Abuja, welcome once again, guys, to ATG Instagram, ATG Facebook. Can one with regular period ask PCOS, blah, blah, something like collagen supplements, can it cause infertility? No. Acetylcysteine, can it affect infertility? No. Can low AMH conceive naturally? If AMH is too low, you might not be able to conceive. Cynthia Vincent, hello, how are you? Can I repeat IVF procedure after miscarriage? You can. Your questions are not answered. I missed them because everything is too fast. If once there are too many questions, I can't see them anymore. I can't even read them. So I might miss your question. I'm sorry about that. Please post them again. Maybe there were so many questions, I missed your question. What causes defect in children and autism? I don't know. I don't know what causes defect in children. Sometimes it's just chromosomal. Autism is probably sometimes, dietary, environmental, developmental, like that. I don't know really what causes autism. It's multifactorial. Can someone get pregnant with one left tube? If you have one okay tube, you can get pregnant. As you only need one tube to get pregnant. You only need one good tube to get pregnant. You only need one good tube to get pregnant. You only need one good tube to get pregnant. What is the normal egg measurement for someone to get pregnant? Usually we want the follicle to be at least 12 millimeter or more. Some will say 20, but the bigger it is, the better. Can ovarian cyst hinder pregnancy? As far as it's not blocking the tube, it does not hinder. But if your cyst is blocking and damaging the tubes, you won't get pregnant. Does collagen supplement affect fertility? Godson, no. But it depends on what supplement you're talking about. I don't know what supplement though. Well, I don't know what the supplement is supplement. Okay, it depends on what the supplement is. Does Primolute end stop bleeding in pregnancy? Not necessary. Does IUI work on the first try? Not every time. Can regular exercise prevent pregnancy? No, depends. Overexercise or if you're exercising too much, it can cause infertility, but it's very, very rare. Very, very rare. Some women get pregnant immediately. Why does others not? We are different, Can taking folic acid increase fibroid? No. I don't ovulate because of PCOS. What can I do? Come to our HGIVF center. We'll talk about that, okay? One day dietary supplement good for pregnant women? No. It's okay, it's okay. 11 weeks pregnant, was not taking any medication? That's okay. Start taking your prenatal vitamin, okay? And get a scan done as soon as possible to check your baby, that baby is fine. Can diabetes cause infertility in a man? No. Diabetes might cause problem with erection with a man, no, but it doesn't cause infertility. Ipopnid tablet. I don't know what that's. I don't know what that is. I don't know what you mean by Ipopnid tablet. I don't know what that is. Ipopnid. I don't know. Prolactin level 25 is too high. Doctor, with big myoma, I have 3 miscarriage. What do you advise? If it's bigger than 4 centimeters, take it out. Did my myomectomy in 13? Yes, I read that question before. What's the question here? You did MRI, you have Vegas fibroid, then take it out. Take it out. Almonzi, take it out now. What's the question there? Take the fibroids out if it's still there. Can some with fibroid outside the womb get pregnant? Yes, you can. You're 34 weeks gone with breech baby. Doctor said there's an injection you can use. God. Okay, you're 34 weeks pregnant. Your baby is breech. They want to give you injection, terbutaline, to make your womb soft. It's a waste of time. First of all, there's nothing wrong in a baby breech at 34 weeks. Okay? Most babies are breech at 34 weeks. So forget about that injection. What you need to do is to go back to your doctor at 36 or 37 weeks. And if on scan at that time, your baby is still breech, we will try and talk to you about turning the baby. We will give you an injection called terbutaline to soften your womb, and they will try and turn your baby and make the baby head down. If the baby doesn't like it to be turned, or if you're uncomfortable doing the turning, we stop it. And then we consider C-section, maybe as an emergency or maybe as a planned later date. Okay? So at 34 weeks, nobody should be busy trying to turn your baby. It's a waste of time because babies will keep flipping as if they're in water. We wait for 36, 37 weeks and they will take it from there. Fibroid, 21 centimeter, take it out. Fibroid, 17 centimeter to 21 cm, Ajayi Moyin, take it out. Doctor said the treatment is to take out the womb. Okay. If you have multiple fibroid, yes, they might suggest that for you. In fact, but if you're trying to get pregnant again, that might not be the best option for you. Okay? So it depends on your future plan to get pregnant. If you want to get pregnant again, it might be better to leave your womb there or to remove the fibers as much as they can. They might be able to remove lots of them, maybe not all, but once they take out your womb, that means that you're going to need what you call IVF and surrogacy at some point, or adoption. So taking out your womb might not be the best option for you, depending on your future plans to get pregnant or not. Is a year plus you stop taking contraception, no pregnancy yet, check your hormonal profile, check your husband's sperm count, check your HSG. What causes recurrent POM at 6 months? Probably an infection. Maybe you're having what we call bacterial vaginosis. Now, guys, I have to go now. My mouth and jaw, they are itching now. I need to go now. Thank you guys for watching again today, listening. We'll continue this question and answer time again tomorrow. So get ready and stay tuned. Once again, I want to say I love you all. My name is Dr. Ololade, and I ask the gynecologist. Ensure we have a seminar coming up this month. It's a free seminar. We have over 4,600 people registered for our seminar already. It's a free seminar. We are able to see at least 10,000 people in that seminar. It's going to be the biggest seminar we're going to have in a long time. So if you're not yet registered for that free seminar coming up this October 24th, it's time to get registered for that seminar. It's going to be an amazing one. So stay tuned, get ready, and get subscribed. It's not this weekend, though. Next weekend. It's going to be a blast. We need and we want at least 10,000 people to be there. It's a free seminar. Subscribe now. If you want one-to-one chat with me to take you through your pregnancy journey to get pregnant, you can go through our premium services. And the links are already on the screen here. Subscribe there tonight and let's start chatting. Once again, I want to say I love you all. God bless you. God be with you. I hope we see you again tomorrow for more discussion, question and answers. Once again, from me to you, love, Dr. Babaji Dalalade at Ask the Gynecologist. Bye-bye.